Welcome to the Cyber Health Podcast, where we share science backed tools and expert insights to empower women's health and elevate their lives. Hello, welcome everyone to this new episode of Cyber Health Podcast. This episode is especially going to be my favorite because it's all the topics that's my work every day. It is AI for longevity, revolutionizing women's health and access generation. And today with us, we have Marina Vieva, who is the leader in this domain. She is a dynamic leader and a self-starting immigrant from Ukraine with over 25 years of international experience across 8 countries. Holding roles such as CFO and CEO, she has a proven track record of growth businesses in a highly ambitious environment. Currently, Marina's mission is to revolutionize healthcare through translational medicine, leveraging horizontal integration across various conditions and vertical integration with payers and insurers. FemiSpace, which is her company, is leading the way in translating science into daily health interventions, building accessible solutions, and pioneering research in female biology. Welcome, Marina.
Thank you, Zara. So happy to be here. Thank you for inviting.
Sure, yeah.
And thank you for everything you are doing, expanding our work and amplifying women's health.
Thank you. I'm so excited to have you on board. We are working on the same category and we both share a lot of experiences and feelings, and we can talk about it all day long. But this episode is going to be about how AI can really improve longevity, specifically for women. So please, let us get into your world. What is that you are doing? What is the intersection of AI, health, longevity, and what is translational medicine? This is the first time I hear it.
Sure. So, Zara, as you know, I started on a mission to algorithmize and digitalize functional medicine approach. This is where I started my research 4 years ago, and I started building it even with classical AI. Now with generative AI, we have more opportunity and more hopes to close gaps in women's health quite quicker, much quicker than it was possible before generative AI. Translational medicine, it's quite a new approach. Basically, this is it's now amplified by technology, where we take all existing science, all the elements, and we do trial and errors in defining how these new science, new elements can be translated into small actionable steps, which literally will amplify and improve health outcomes of each individual. So it can be in the hospital settings or in a digital solution, etc. Of course, I'm focusing on the simpler and the quickest way to deliver health and to improve health outcomes, which can deliver it at home through app, and it's fraction, of course, which traditional conventional medicine offers to current health seekers, let's say.
Okay, that's great. That's great. And so how does AI, obviously I know, but for our audience, how does AI and health and longevity connect the dots together, especially for women, and why there's going to be a difference? Why women? Why not everyone?
Yes, absolutely. Also, there, you maybe know what till 1990s last century, women were not included at all in clinical trials. Their landscape started changing, but not in the speed we wanted. We want and we need to close the gap. Even, you know what, like the cost of one medication to be developed, it's can be anywhere from $500 million to several $1 billion. And you know that up of today, still there is no strict requirements to include women in trial, and there is no clear definitions. And we also know that there are so many cases where even with death cases for side effects from medication which were never trialed on women. So how AI can help us? Of course, we cannot redo all those tests, and we cannot impose some other criteria we want on their on pharmaceutical developments, but AI can help us. AI can help us to speed up development on new therapeutics, on new pharmaceutical components, which will be able to test as reaction on female biology, whereas even AI in combination with nanotechnology, etc. We have some scientists working on developing like uterus or ovarian, which is on new technological materials, but and with help of AI, they can test how certain therapeutical or medical drugs will affect our organs and how they will affect pathways in our biology. So although AI will not reduce dramatically cost of those developments, but it can shorten certain stages, which will save us 15 to 20% of time go to market and development. So in many, many others, basically generative AI, new generative AI now will help us to close a bit quicker the gap for women's health than we were hoping before with the classical AI.
That's great. Now we are recording this episode in January, and last week was JP Morgan Healthcare, and a lot of topics and conversations were around including women in the trials. As you said, there were so many unfortunate events happening, death, as you mentioned, especially on underrepresented and minority communities, where women were not included, especially like Black women were not included in the trials. And then the outcomes of the treatment was drastically different. So that's why it's really important to consider a woman. And as a woman, when you have been given an instruction or a procedure, usually doctors these days say, do you want to do this or that? And it's good to engage your doctor in this conversation. These days, we have to do our homework. I'm sorry that life is not fair for us, but that's the way it is. So this podcast and this episode specifically is to raise awareness about that not every solution, unfortunately, can bring the same outcome for women. And it's really important to do your homework before agreeing to anything and challenge your providers. But digging more into that, even the outcome could be different vastly, among the women. So that's why it's really important to do more personalization, and that's where AI can help. So I want you to learn more about you, that how do you see that level of personalization and adjusting and fine tuning in different aspects of health for women, importance of it, and how AI can help.
Absolutely. This is just exactly to the point what we are talking about. I'm so happy it was raised during the JP Morgan conference, which unfortunately I was not able to attend. And even if AI might not be able to fold our laundry yet, but it can do a lot of things, especially on prediction, early prediction, early detection of what is particularly concerned women's largely affected, more affected by the women, and especially in an age, and when we talk about perimenopausal transition, menopausal transition, and all this estimation, predictive analytics, which we did not exist and still were not explored to the extent what is needed. What we are building at FemiSpace, we really go far and beyond what is already done, and we integrate in for women female biology and hormonal components and absolutely every predictive analytics, where otherwise conventional approach built by very often by men, if the biology behind it, they do not include. There are initial very small traction attempts like clinical trials, starting building predictive analytics inclusive of hormonal health and hormonal parameters, but it's insufficient. For example, one big area of metabolic health and women's transition to the second part of the adult life, let's say after 35, 40, is liver health, which affects how we transit in perimenopausal journey, what are our risks. And you will be surprised what all the academic literature studied, all the risk scores analysis, etc. None of them include hormones, and none of them are specific for women's biology. So this is where one of the areas we tap with AI, including all the data, all parameters which are already known or unknown, building initial predictive analytics. We will be iterating with the data, and finally testing on population have to see what can be kind of stabilized as a predictive analytics for women's health.
That's great. That's great. So, how do they collect data? Since women has been historically underrepresented in trials, there's a lack of data about like female body specifically, like interaction with these different procedures and different medications. How do you see the technology, maybe wearables, maybe like other sides of different apps these days. There are so many information, but how do you see the data collection, for this specifically personalization for female body?
Yeah, absolutely, absolutely, Zara. So, and this is a big topic. Everybody talks about collections, and of course, there are areas where it's already uh, explored, and everybody seems like doing it, like collecting data from variables, tracking biomarkers, or tracking exercise, or digital markers, as we call it. It's good. This is where we should go. We should go in this direction, and we should collect it. And of course, we are doing that. You are doing that, I'm sure. But we, all of us, need to take this collection data to the next point, because what is happening now, and I know from by the fact, there are quite a few players in the market who try to integrate all the variables, all things we can collect, but this data is not used for the user health benefit. This data is used to build databases to monetize it. And this is where we still have a lot of work to do. Even on unsettled FemiSpace, I said data protection is going to be the highest priority of what I'm building. We are collecting a lot of data. We want to collect variables, nutritional intake, various lifestyle aspect of the user journey. But the thing is, what we all have to strive, we need to strive to protect this data and to use every single piece and bit of this data to improve user health outcomes, to link it all together for the user specific case, and to build from that hyper personalized journey. So there is a lot of data, but still there is much, much more to do about how to use data, because the healthcare system sits on I don't know how many millions of terabytes of data, and it's commonly recognized what this data is not delivering any health outcome, unfortunately.
That's correct.
Yet.
Yes, yes. While we are really advanced in technology, but unfortunately in the field of healthcare and especially in the field of women's health, there is a lot more need to be done. But hopefully this time, since we have this great technology, we can do it faster in a more efficient way. So speaking of data, one of the top hottest questions is that who can access this data? Who owns this data? It's my data. Is it I'm the owner of it as a patient, or who collects the data is the owner of it? And I know this is not like a kind of a black and white question. There is a gray space, obviously, but I'm curious to know your thoughts on that.
It's not black and white at all. User owns data, but you know what, Zara? And I'm about to make a special post on that on LinkedIn. I just decided to look. You remember, like several months ago, I was aware by some of my community. I looked on LinkedIn. You know what? Almost every device you will be using right now, when we onboard AI features, by default, we say that as you consented to share it. And this is absolutely nonsense in terms of the data privacy, and looks like nobody cares about it. So just recently I went back to check my ChatGPT, and I realized what by default it's turned what I consented to share all my data for training purposes. So luckily I check it now, was conscious what I share, what I do not share, and I unchecked it. But LinkedIn is the same. So my first advice, check all your devices, everything we use, go to setting and to see every user advice, to see what is defined as the sharing of data, because by default, market is doing what you share your data. The data belongs to us. And it looks that even the law kind of supposed to oblige every collector not to use it unless explicitly asking the data owner to share it. It looks what it doesn't work this way. It looks what is actually exactly the opposite. By default, we without consent define what you're consented to share the data, and it's on our responsibility to check it, to ask if we cannot find, and if we do not share explicitly, either to uncheck this selection, or to send a mail to the provider saying I don't want to share my data, delete it or stop sharing it, etc. So my short answer: user user is the owner of the data, and the user has to have final responsibility who, when, and how uses here on his data.
Exactly. Yes. I totally agree with you.
What is your yeah?
I totally agree with you on that. I just want to add that you always have to, it's a trade-off, right? Even when you go to your doctor in your doctor appointment, you're sharing your information. Basically, you're sharing your data. They do blood work. You're sharing your bio information. You're sharing everything, but you have to see like what's the outcome of it and how they are using your data, how they are handling that. And it's the same way when it comes in digital health, because still in digital health, yes, we are collecting data about, how you breathe, how much water do you intake, how many steps do you have, what's your heart rate, so many different things, tracking your menstrual cycles, all the medication, but it's that the outcome of it, it's to your benefit. Then and obviously, the company shows that data privacy is their highest toughest priority. Then I would say that I would acknowledge that and I would hope for getting better results. And the other thing is that since women, and especially this is a really, I think it needs a kind of national movement, since women has been historically underrepresented in so many of healthcare trials, it's really important to help these organizations who are in goodwill to get access to the data. And we help that movement to reach the goal that they have. Hopefully, they will be handling data in an appropriate way. And as long as it's de-identified, I don't see any harm with it. Annette as a data analyst, data scientist somehow, some days. But definitely the end goal should be the user, and he or she should be the owner of the data, obviously. So let's now talk about longevity and how all of these that we've been talking about it so far can help us in the longevity. How do you see longevity being different from men to women, first of all?
Absolutely. And so, Zara, first of all, I'm so happy we are aligned in terms of data. And I want to send my last phrase to close it. But we are building tools to empower women, not to exploit them, all their data. So ethics of using data, it's not a fad feature. It's really foundation for us. So now let's move to longevity. And yes, longevity is a quite interesting thing for women. Even if women live 3 to 5, sometimes to 6, 7 years longer than women, depends on geographic location in the world. It's still women lives 20 to 25% more of the years in poor health compared to men. And it's the reason for that multifold. It's not just one reason. One big reason because women start having a surge of multiple risk during perimenopause and menopause, where we see women approaching men's rates in cardiovascular health, and also we are hit even more than before those years with autoimmune conditions, with osteoporosis, etc. This is one part which was not studied, as you know, like the study about menopause, how many years is like 10 years, like 15 years, started really paying attention to that. And of course, all different symptoms which women have. This is which were never studied. It's different expression of symptoms. It's never studied symptoms, early detection. So longevity I can bring together because so many things can be predicted earlier. This journey of transition, hormonal transition of women, and managing risk at the later stage of life, it's all can be tackled earlier, can be predicted earlier, and with a fine tuning of personalized data and scientific data which already exists, it can be used to prolong health span of women and to make easy transition during those difficult hormonal adjustment years, which is so dramatically affects women's health and also mental health, and generally how she manage her life during those years.
Great. Yeah, totally. I am personally in favor and a champion of prepare and prevent. So the more you prepare yourself and the more you will be able to prevent lots of, especially health challenges.
that we as a woman can face in throughout our lives, like, different stages, starting from puberty to, going into adolescence, even like getting pregnant, being in a pregnancy, postpartum, all the way like to your mid-career kind of age, and then, shifting towards the menopause. And I was listening to a podcast the other week that was talking about how in the recent years, because of the whole living situation is different compared to 100 years ago or even 50 years ago, stress and so many other things around us. Impacted women in a way that we see now premenopause starting like much earlier than before. And for women to opting on a healthier lifestyle even as early as their 30s. And I was like, oh damn, I'm already late. Even as early as their 30s, it can significantly improve the symptoms of, the menopause, and they can transition into that stage much easier. It's not only beneficial for women, but it also reduces a lot of cost and burden on healthcare system and insurance and everybody. So it's really like a kind of win-win. There's no doubt about it. That's why, when we talk about longevity, specifically focusing on women body is very important. And that's and that's also our mission at Cybele Health, the company that I'm building to help a woman to prepare and prevent whatever it's next for them in whatever stage they are, no matter of your age, especially if you're working, handling work and home, and if you're a mom, kids, everything else is really overwhelming. And with the society that everybody shows their success stories, it's really hard. Like mentally, there are lots of burden. It's really important to dig into that, and AI can definitely help. So from your experience and researches that you have been done so far, what do you see as the key factors in impacting a woman's health span?
Yes, Zara, I'm so glad you have the same observation and research follow as I am about the status of hormonal health in women's population generally across all life stages. And we already talked, we will have another specific podcast about menopause and menopausal transition. Based on my observation research, I started on longevity and hormonal health like close to 10 years ago. It's true that perimenopausal symptoms in menopause are coming early and early. Every 5 years, this happens early and earlier in women. It's definitely it happens earlier than the mothers and by grandmothers. And there are big culprit there is what we eat and the air we breathe and their environment toxins, which are extremely damaging to our ovarian. And this is what ages ovarian of women like very quickly. And it goes accumulated year by year. The same from early menarche to um, a lot of imbalances in hormonal health and with perimenopausal symptom, which really, as you mentioned, started you see on 30, yes, early 30. It's crazy. It's literally, it was for me such a shocking experience when I started building like a cycle tracking part of my solution and was for exploring, doing research, following and even talking to some users and younger population following competitors. And I was really shocked to see how many women in early ages, early age, younger age rather, we have hot flashes. Hot flashes has it's very big indication because apart from certain infectious condition, I don't remember how it's called, very strange one, very rare one, where this fever gives hot flashes. There is absolutely no other disease which will give hot flashes. So it's very particular symptoms. So basically, when women has hot flashes, it's the only indication rapid decline of hormonal health if she is not in her late 40s, right? So this is a lot of things which need to be done, and why I I know we have a bit different focus, and this is how it should be. You focus more on already this period. I'm actually want to focus more on preventive, something which has need to be started 10 to 15 years ago, and there women need to adjust one by one, adding small changes to the lifestyle, which accumulates. which accumulates, and then it will be easier to transit, because when women are already in this perimenopausal transition with all accumulated toxins and damages in the body, she needs to go with really like cold turkey on many things to alleviate her symptoms, etc. It's very difficult. It's very difficult. It requires such a hard and amplifying intervention of all aspects, and really like the highest degree of all compliance and all interventions. So it's easy to start earlier, adjusting a bit those areas, like which products we use, which products we put on our skin, which absorbs everything. Even the shower we do, because through our skin we absorb a lot of chlorine, which is hugely toxic, not only to our ovarian but also to our brain. So there are a lot of things to be done, and for all of us, it's like a lot of work to be done in every life stage.
Sure. Yeah, definitely. So, healthy lifestyle, has a big span around what we do, what we eat. Obviously, the level of activities and exercise, what we put on our skin, as you mentioned, all of that. And to those who argue with me about specifically like eating healthier, and even like when you eat at home, try to like opt on ingredients who are less toxic, has less pesticides, more organic, and was like, it's so expensive. And I love that saying that says, do you want to pay to the farmer or to the pharmacy? That's your choice.
So absolutely, we will need to do podcast on the real case studies. I did it across 8 countries with several clients and people. You know what? Once you start putting in your basket ultra processed packaged food, you pay more. You pay more immediately on the food, because the value for dollar of nutrients which will make you full and you will not feel cravings to eat more and more is much, much lower in processed food. But all processed, everything packaged costs more. So if you compare, and I did several times, we can actually do experiment again in San Francisco, in New York. I did in San Francisco already. You compare two baskets, like regular baskets and healthy ultra processed food, how much it costs and where it will take you in terms of fullness, how much you will feed yourself. And second basket, where you put a lot of like legumes, just unprocessed, just one package, you put even pasta, doesn't matter, anything unprocessed, big volume, cabbage, whatever, and how much it will feed you, how much fullness you will have. And I'm not even talking about impact on health. Even if it will be organic, it will be still the same price, or sometimes even cheaper, depending on which processed food you are buying.
Yes, yes.
So this
Yeah, obviously. And inflammation that it causes, and especially for women going through hormonal changes and, menstruation, inflammation is one of the key factors of your metabolic health, and reducing inflammation has great impact on your longevity. So, tell us a little bit about your startup, FemiSpace. What do you do? Who can use it, and at which stage you're at now?
Yeah. So we are preparing to launch our final upgraded solution in March.
Hi.
And although we worked on infertility, particularly on perimenopausal solution, prevention of diabetes and cardiovascular diseases, we still have all of it. But we decided to focus initially on one particular condition, which is called cardiometabolic health. And the reason for that, because this is the root cause on everything I just mentioned, and 10 more conditions which are killing population, from diabetes to cardiovascular diseases to Alzheimer to even most cancers. So cardiometabolic health is the basis for all health. And this is where we're going to focus with our improved approach, improved risk predictive analytics, risk scoring, where we'll be integrating all female biology, all the data variables to build hyper-personalized program. And we are also meeting the user where she is. It doesn't matter what was done before, what is the readiness. We just define for each user 1 to 3 steps, which is easy to implement and will have the biggest impacts on the health outcome. And of course, then it will grow with the user, with the user, grow with the user in health education, health habits adjustments, and to lead to the healthier lifestyle and to the longer healthy life.
Nice, great. So is it B2C, like any consumer can use it, or are you surfacing to the providers?
Initially, it will be open to everyone, and we want to make it available to a long list of B2C users, basically, and customers who opted and interested in our solution. But we also have strong interest in from some clinics where we are starting discussing what will be the best customized solution for them to test it. And of course, we are interested to talk to insurers where we will be able to offer them reducing of health cost of their biggest problems we're facing, like diabetes and liver disease and cardiometabolic risk, especially which are rising like doubling or tripling in female population after 40.
Yes, yes, exactly. This is the leading cause of death in United States, cardiovascular disease. And I'm sure in women is also a significant number. So you heard it, everyone. If you are interested to check it out, we will put some links and information on how to get access it. But thank you so much for everything that you're doing. Definitely working on improving so many things that should have been done way long ago. Requires an army of engineers and scientists and educators and everyone. And I personally appreciate the work that you're doing. So, what is the best way if somebody is interested, want to reach out to you, how they can find you or how they can get access to your platform?
Yeah. Absolutely. You can find me on LinkedIn, Marina Vieva, everywhere Marina Vieva, LinkedIn, Instagram, Twitter. Our website is www.femispace.com, FEMISPACE.com. And you can express your interest, submit your email, and we will contact you. We will be the first one to be on board on this amazing the solution we are about to launch.
Great. Awesome. Thank you. And I have a good news that in January of 2024, most of insurances, including Medicare and Medi-Cal, opted on new reimbursement codes for preventive care, especially in women's health sector. So I'm sure that there is a way to, if there is any cost, insurance, if you are insured or have insurance policies, can help you to reimburse part of that at least. That was really great. I really enjoyed our conversation. I know that we can talk on and on and on, and I promise our audience that we are gonna have another session. Please leave your questions or topics that you want to discuss with Marina in the comments. We will definitely review that and schedule another call, record another podcast. But yeah, that was really great. If you have any final words with our audience, please.
No, I want to thank you, Zara, for doing this. This is so needed. We need to bring out there the word. And I know what you're doing with your project, your tough part of closing the gap of women's health. So thank you. Thank to you. Thank you for having me. And we should support each other on this difficult journey. And there are so many things we have to do.
Sure. Yeah, definitely. All right. So this is it. I hope you enjoyed it, and I hope that you take care of yourself and take responsibility for your health. Understand who is accessing your data. Understand how AI can help you and your health. Opt on a healthier lifestyle. Talk to your doctor about it, and definitely follow Marina for her FemiSpace and what it has to bring. Okay. Thank you so much, everybody. And mine's Zara. Yeah. Till next time, take care of
Till
yourself.
next time.